Hello, everyone. A very good evening to all of you. I am Shayani Dey. Welcome you all to today's Facebook Live session, where we shall talk about how to cope with anxiety during fertility treatment. Now, going through fertility treatment, it can feel as though your life is on hold, and it is hard to move forward or plan your future. Sometimes you feel as though you cannot confide in anyone who will understand what you are going through. Now, counseling in such situations is an opportunity to explore any emotional difficulty, fears, and anxieties or distress that you might experience your fertility in your during your fertility journey. It can help you to cope, make choices, and change aspects of your situation. So, to shed some light on this topic, today we have two eminent speakers with us. Dr. Roindri Sanyal, fertility specialist, Nova IVF director, and Miss Indu Malik, fertility counselor. Welcome, ma'am. Welcome, Roindri, ma'am. A very good evening.
Thank you, Shiny.
All right. Uh, so, Indu, ma'am, I think there is some technical glitch at Dr. Roindri's with Dr. Roindri's connection. So, we shall just go ahead, right?
Yes.
So, our first question, ma'am, today is does stress play a role in the success of fertility treatment?
Yes, Shiny. Definitely, stress plays very important role at the outcome of our treatment. And stress is very normal and natural response of our body. But when it becomes prolonged or chronic, definitely there are evidences when your cortisol level goes high, so the chances of implantation is less, and there are fair chances of miscarriage also. So excessive stress, I'm not saying this mild and moderate excess, but prolonged or chronic or severe stress definitely plays important role at the outcome of the treatment.
All right. So, and what do you think? How does one cope with the stress as she waits for the for the test results, which is so important?
See, only for the test result, this 14 weeks, this 2 weeks wait period is very crucial, because no one can do anything to enhance the result, but definitely there are certain strategies and some tools by which the patient can cope up with the stress and the anxiety and can remain cool and calm. Because when all the time there is an obsession, what will happen, what will the result
Hmm.
will be will it be uh, positive, if it will not positive, what will I do? When this excessive anxiety becomes very very obsessive kind of thing, then it becomes the sometimes the patient get panic attack, and too much anxiety is not good. When they
Hmm.
schedule their day and engage in certain activities and don't obsess what will happen, try to stay positive, relaxation, and engage in other certain activities like pursuing hobbies, whatever not have done till yet, new hobbies and some relaxation, and scheduling anxiety time, scheduling obsessive time plays very it works as a tool. Because when since morning to till late night you are thinking what will happen, oh my god, if it will be not positive, and you are trying to understand, you are trying to see some symptoms, you are googling. Stop googling, never try to do because in Google there is a general information, and what happens in this 2 weeks wait period, women try to find out some symptoms, and if they don't get symptoms they think this it is going to negative, but it's not right.
Hmm.
And when they schedule this worry time or anxiety time, So like before dinner they can schedule for 20 minutes. So they can keep their anxiety at bay. How? If anxiety creeps in the morning time or any time, then they can tell their brain, okay, I'll think this in my anxiety time. And this is a particular schedule at any they can fix the time, so they will not become anxious. It is the best way to cope up with this 2 weeks wait period. And there are certain other things. Talk to your feeling. Don't suppress your feeling. Talk to your partner. Talk to your dear ones.
Right. Ondri ma'am, you're back. Hi. So, uh, ma'am, we can't hear you properly. No, you're not audible, ma'am.
She's not audible.
Yeah, ma'am, you're not audible. So, we shall continue. Indu ma'am,
Yes.
you were saying something. Huh.
Yes. So there are so many tips, and they need to learn before transfer. Because before transfer they have to plan how they have to go. If they are working, it's okay, and it depends. If
Mhm.
they like their work, definitely they should go for work. If the work is very stressful and uh, a very hectic kind of, then they can plan some leave and
So it
can
is,
pursue.
hmm.
Hmm,
Is it seen in the working women mostly?
sorry.
Is it mostly seen in the working women these days? Uh,
Yeah, I mean, mostly women are working nowadays, and this is added stress, how they have to plan the leave and all. And nowadays, working from home is easy. They are doing, when you work, it gives you a sense of achievement. You are working something, you know. So they shouldn't take, if the work is good, it's interesting, they should not leave the job, or they should not take leave, because it gives a sense of achievement, it gives a pleasure. So it depends on every individual woman, what they want, what is their interest.
right. Ondri ma'am, is your connection back? I'm so sorry, ma'am, we can't hear you. You can wait for 2 minutes, ma'am. You can fix it and connect again.
And Saini, you have taken a very good subject, very good topic. It's really important. It's
It
really,
is.
really important. Yes. And the IVF treatment is itself a very sensitive treatment.
Absolutely.
Very
It's a very
sensitive
sensitive
treatment.
uh, topic
Yes.
as well. Yeah, yeah, absolutely. Is it working, Indri ma'am? Can't hear you.
I think we can go ahead.
So, yeah. All right. Now, ma'am, next would be, how to prepare oneself to accept failures and stay positive, which is so, so
Yes.
important.
It's very important. See, nobody prepares for this failure, right? Everyone expects that results should be positive. But when it happens, because it's not in anybody's hand. So there are some, you know, before acceptance, of course, it's very painful. It's very, very hard, because lots of
Mm.
emotions are attached. It's not a kind of, the failure. It's a failure of it's a loss of dream, it's a loss of hope, it's a loss of expectation. So it
Hmm.
takes time.
Hmm.
So before acceptance, give some time to yourself. Give permission to feel the pain, to feel the grief. And this grief comes in several stages like denial, shock.
Mhm.
No, it is not possible. It cannot happen. Anger, anger on her, on own, or anger at other person, anger at maybe medical team, anger at God. Then bargaining. Maybe I would have done this, I would have taken rest, I would have done this, I would have taken better care, I would have gone to somewhere else, kind of thing. And then the depression,
The depression
feeling
phase.
of
Hmm.
feeling of sadness and acceptance. So it is those stages are not a linear, it is a back and forth and back and forth, and some after some time this acceptance come. Before acceptance, please try to feel your pain, don't suppress your pain. Yes, it's very hard, but and don't ignore. So many women try to ignore their pain and they
Hmm.
rush to the other treatment, you know,
Hmm.
for the
Hmm.
other cycle. Give some break and give permission to yourself to feel the pain, and after acceptance, then definitely you can be positive. There are so many things to how you can be positive for the further result. And ma'am will be agree with me if she's listening to me. Every failed IVF gives some clues for the successful IVF treatment, you know. Are you hearing, ma'am?
Ma'am, Oindri ma'am, could you just take off your headphone once and try?
Right now,
Perfect.
Yes. Fine. Yes.
audible?
Absolutely.
Oh, okay.
Yeah, yeah,
Then
you are
probably some
audible.
problem in the headphone, probably. I don't know.
Hmm.
Yeah.
Okay.
So, ma'am, I was talking about the acceptance of failure and how they can be positive. I was telling that, every failed IVF cycle gives some clue about the further successful treatment, Maybe you can do something else, kind of thing.
Yeah, very true.
So,
I'll just add here, Indu, just one thing. Actually, you know what happens? IVF is a treatment which doesn't guarantee you 100% success. Even in
of
the
course.
best of centers worldwide, the success rate, the positivity rate is around 60 to 70%, sometimes maybe 50 to 60%, depending on patients. And the take home baby rate is even less. Okay.
Right.
So the
Right.
thing is, for a patient to succeed in IVF treatment, it is very important that the patient is counseled that your one attempt may not be successful. আমি বাংলায়ও বলছি একবারই নাও হতে পারে, হতেই পারে আইভিএফ এ একবারে হলো না, we may need second or third attempt. ঠিক আছে, কিন্তু এবার প্রবলেম
Absolutely.
আমরা যেটা দেখি যে পেশেন্টরা ট্রিটমেন্টে স্টিক করছে তারা কিন্তু কনসিভ করে, যে ফার্স্ট অ্যাটেম্পটেও হয়তো করলো না সে হয়তো সেকেন্ড বা থার্ড অ্যাটেম্পটে most patients will conceive by IVF. And the reason is what Indu said is right, because whenever a patient is also failing one IVF attempt, by then আমাদেরও কিছু কিছু knowledge হচ্ছে about the patient which we probably did not know beforehand. So this knowledge also helps us in future IVF treatments. কিন্তু প্রবলেমটা যেটা হয় সেটা হচ্ছে মেকিং দ্য পেশেন্ট স্টিক টু দ্য ট্রিটমেন্ট. There are countries in the world where the cost of IVF is borne by insurance. So only cost is not the factor. You know, Shiny, there have been multiple studies যেখানে ওরা দেখার চেষ্টা করেছে why patients don't turn up for a second IVF cycle. ঠিক আছে, আর সেই
Hmm.
কারণের মধ্যে আমরা সবসময় ভাবি বোধহয় কস্ট ফ্যাক্টরটা বোধহয় সব থেকে বড় কারণ, যে কারণে হয়তো পেশেন্টরা আর সেকেন্ড বার আইভিএফ করাতে আসছে না, খরচের
Hmm.
জন্য আসছে না, কিন্তু ইট ইজ নট সো. The most important reason has been found to be emotional reason, because even
Right.
if the cost of IVF is being borne by insurance, কিন্তু the patient doesn't want to go through that emotional turmoil once more. Okay, so it is very important to handhold patients. Our problem টা হচ্ছে this handholding cannot be just done by a clinician because for so many reasons. One is, in a country like ours with such a big population, clinicians are very busy. ঠিক আছে, সেখানে clinicians are more engaged in their clinical work. পেশেন্টের কেন হচ্ছে না, কি করা যায়, they are more engaged in that. So probably time for each individual patient is less. And second, definitely a clinician, an IVF clinician is basically a gynecologist who is not trained in psychology or psychiatry. Okay, so we do need a trained psychologist or a psychiatrist to handhold the patients. ঠিক আছে, যে যার কাছে গিয়ে পেশেন্ট ক্যান প্রবাবলি মানে ডিসকাস এনিথিং এন্ড এভরিথিং দ্যাট ইজ অন হার মাইন্ড, এন্ড ইভেন দ্য হাজবেন্ডস অলসো নিড কাউন্সেলিং, ইট ইজ নট অনলি দ্য ওয়াইফ, দ্য হাজবেন্ড
Right.
অলসো নিডস কাউন্সেলিং।
Right.
ঠিক আছে, and not to say there are so many other delicate issues involved, কারণ অনেক সময় there may be instances where a patient may be opting for third party reproduction, acceptance of those like donor sperm, donor egg, those do not come easily. তো এইগুলোর জন্য we need a psychologist at every step of the procedure.
True. So
Yes, ma'am.
exactly, I mean, like you highlighted about the about counseling like for both partners. তো এখানে হাজবেন্ডের যেরকম কাউন্সিলিং ইম্পর্টেন্ট, সেরকম I think family also has a very, the entire family has a very
Yes.
important role to play.
Yes, Shani,
Yes.
very
Ye- Right. Absolutely right, Shiny, because of course, it's an individual's problem, couple's problem, and whole family also get affected,
Right.
because they have also a kind of emotional attachment,
Mm.
and couple counseling plays very important role
and
before the
Indian
treatment.
families are like they are joint families mostly. So most of the times the parents or the in-laws, they also want to know what is the problem, and I mean, but they also need counseling, not just regarding the problem, regarding how to deal with the problem, everything.
Of
The
course,
acceptance, I
because
think, is a major thing here.
Very
A
true.
yes,
lot of
And
a lot of
just
us
remember,
are.
Shiny, these are new treatments, new things coming in every day. These are mostly technology-based treatments. So these are very alien to most people.
Correct.
Most of the times, the parents or the in-laws, they would not have even heard of IVF. IVF এর নামই শোনেনি, IVF কি
সেটাই,
তাই জানে না। ঠিক আছে,
একদম।
কারণ তাদের বলার থাকবে আমাদের সময় তো এসব লাগতো না।
হুম,
ঠিক আছে, তো
হুম,
এই জিনিসগুলো we need to counsel them. This is not uncommon in today's times. That somebody may be needing an IVF treatment. ঠিক আছে, তাই জন্য not to judge or blame their son or daughter.
exactly, not to judge.
yes,
Absolutely.
yes,
Awareness is very, very important, and we should all be, responsible. এই ক্ষেত্রে।
yes. I do a lot of family counseling also in terms of this in-laws, because when the counselor psychoeducate them, what is the problem? The problem is in your son also, and then they start treating their uh, daughter-in-law in a different way. Daughter-in-law is herself, very sad. It is not happening. She also wants to become a mother. They also want to become a parent, but in the added pressure of in-laws, makes them much more sad or depressed. Then when they accept, then the in-laws accept, yeah, this is a problem, and they start treating their daughter-in-law in a very affectionate manner. It plays very important role in the outcome of this art treatment also, I have seen.
And unfortunately, what happens in IVF, in infertility scenario, what happens most of the times that it becomes a blame game. মানে most of the times the couple would come to us and want to know দোষটা কার। We
কার,
always telling them দোষ কিছু নেই, there is no দোষ। ঠিক আছে, it is, I mean, most of the times actually the fault lies in both the partners, and even if it lies in one of the partners also, that doesn't matter. Fortunately, we have IVF nowadays. It doesn't
Right.
give us a 100% success rate, but it does give us a fairly good success rate. So that is the thing. This counseling is very important. That is the first thing that the couple should be told. যেখানে কারো দোষ নেই. Nobody is doing anything on purpose.
সেটাই, exactly.
Just it is
Keeping the
like,
disease.
yeah,
Exactly. So
They
according
should
to WHO, the infertility is a disease. So that is how it should be treated. Like আজকে আমার হার্টের অসুখ বা ব্রেনের অসুখ হলে যেরকম আমি বলি না যে সেটা তার দোষ, same for infertility. It is not anybody's fault that somebody is having a fertility issue. ঠিক আছে?
Yes, if they take it is a medical condition and it's impairing our reproductive health, and we are taking help, definitely it is going to be cured. It
Exactly.
should be the mindset.
It should be a very open-minded approach.
And
We should be
Shiny, as you
sensitive
told,
towards each other also. Yes.
yeah, Shiny, I want to add here, as you asked about how to accept this failure. First of all, the women should understand it's a treatment failure. It's not their personal failure. It's a treatment failure. You know, they should not take it as their own identity, that something is defected in my body. No.
So true. Right. Absolutely. Absolutely. And ma'am, do you think that relaxation therapy really works?
Yes, relaxation therapy definitely work, because when your mind and body is relaxed, so definitely your body works in a good manner. So relaxation therapy, it can be anything, like simple deep breathing. You are
Right. If
working
you
a
can
lot,
just
at
highlight
least, yeah, for
that.
1-2 minutes you can do this deep breathing and this mindfulness meditation. It really works. And uh, this any kind of exercise, it also gives you relaxation. Apart from those relaxation technique, self-soothing activities also helpful in the relaxation. Anything which you like, because due to IVF treatment, you know what happens, you put your life on hold, you don't do anything. Before this diagnosis of this fertility issue, you were doing a lot of things. You are playing a lot of role as a daughter, as a wife, as a friend, as an employee, as a colleague. But when it happens, your whole life revolves only in this thing. Don't do this. Try to pursue your hobbies and do something which gives you a sense of happiness. Any activity, so it helps in the relaxation.
Right. Absolutely. So true, ma'am. We can start taking the viewers' questions also. So a lot of people are waiting, and so there is this person, Urjashri Mojumdar, mentions that infertility treatment should be treated as any other treatment for any kind of health condition. Absolutely, very true.
Yes, absolutely. And there should be because this is not only a medical condition, it's a social condition, it is an emotional condition also. Because we are conditioned, our society is conditioned like that, that it is a woman's responsibility, and if it is not happening, there is some defect in woman.
Hmm, hmm, hmm.
This should be this taboo, this should be
We should
removed
come out of
from society. It's just a medical condition, nothing else.
So our next question is from Suraj Bakchi, and the question is: it is known that stress has an opposite effect on IVF treatment. It has a tendency to mess with one's potency. As a man who has come to know that he has to go through rounds of IVF, is he supposed to cope with that or that kind of stress? So I think what he is trying to say is from a perspective of a person who is
Yes,
undergoing IVF. Hmm.
yes, of course. Yeah, Suraj, you are absolutely right. But don't think that you have to go for the several rounds of IVF. Maybe it can click in the in a first one, or maybe it can take time. Don't focus, focus on how you can enhance your fertility, how you can enhance your success. Because when you will be stressed, so definitely it will impact somewhere. And if you are stressed, then you will be, maybe you will have the uncoping, unhealthy coping style, like you might engage in unhealthy life thing like smoking, taking alcohol. And if you focus that how you can, if you can adopt healthy lifestyle, doing exercise, eating nutritious food, and doing some relaxation, then and talk to your partner, take it easy, go slow, so definitely you can cope up with your stress. It's not hard, but there are certain strategies, certain techniques by which you can de-stress yourself.
Right. Unji ma'am, would you like to add a few points here?
Yeah, first of all, whoever, I mean, Suraj, from wherever you are calling us, the first and foremost thing I would like to say, see, what you have to understand in the first place, that IVF treatment is not so abstract nowadays. It is a very standardized treatment, and it is getting more and more standardized by the day. When I joined this particular discipline way back in 2007, we used to say that IVF has a positivity rate of only 30 to 40%. And from that, the positivity rate in good centers, most standard centers, have gone up to almost 60 to 70% now, which I think is a fairly good success rate. And of course, we expect in future it may go up even more. তো সেকেন্ড যেটা সেটা বোঝার সেটা হচ্ছে যে সি this is for all treatment. When you are going for any other kind of treatment, say you are going for a heart operation, you are going for an orthopedic operation, you are going for anything else, for a brain operation, anything, does anybody guarantee you 100% success rate? Nobody can do that. So the same holds for IVF. And of course, as I already mentioned, that patients who stick to treatment, they conceive. So it is not as if you have to go through, it is not mandatory that you have to go through multiple rounds of IVF. Believe it or not, most patients conceive by the first IVF treatment. 7 out of 10 is a good number. So, and even if you have not conceived by the first IVF treatment, believe me, most of the times by the end of the first IVF treatment, both you and your clinician would have known why the treatment failed. It is only in very rare instances nowadays that we completely fail to understand why the patient is not conceiving. Of course, there are few instances like that where even as a doctor we cannot figure out why the patient is not conceiving, but those instances are few and far in between. So the most important thing for you to understand is be positive about the treatment, be optimistic about the treatment. I am sure if your doctor, I'm sure your doctor would have counseled you through the about the treatment, your chance of success, your possibility, the reason for your not conceiving, and in that case, if you stick to the treatment, you will surely conceive.
Okay. We'll take the next question from Shushmita Shikdar. Shushmita is asking, can a woman receiving IVF treatment be prone to panic attacks?
It depends, Sushmita. It's not necessary that women prone to panic attack when they are going for IVF treatment. As I told, when this, this anxiety is normal. You imagine that maybe something, maybe if it will not happen, if it will not be positive, what will I do? It's normal because anxiety is a normal natural response. But when all the time you are thinking you are becoming obsessive, there might chances that it may be this anxiety turn into a pathological or it turn into an anxiety disorder. Then it can be someone can have a panic attack. It is not necessary that the woman is going for IVF treatment and she will have panic attack.
আমি এই জায়গায় জাস্ট একটাই বলে রাখবো সুস্মিতা বা যারা শুনছে তাদের সবার জন্য, যে পেশেন্টদের যারা আইভিএফ করতে আসে তাদের অনেকেরই ধারণা আছে আইভিএফ ট্রিটমেন্ট মানে আমাকে সবকিছু ছেড়ে দিতে হবে, ছেড়ে আমাকে 10 মাস বিছানায় শুয়ে থাকতে হবে, ঠিক আছে? দিস ইজ আ কমপ্লিটলি রং নোশন। আই ক্যান নট মেক প্রবাবলি এমফাসাইজ এটা কত ভুল, ঠিক আছে? Patients who are working, they can continue with their work, they can continue with everything while they are undergoing IVF. Pregnant হলেও সবকিছু কন্টিনিউ রাখতে পারো। IVF এ প্রেগন্যান্সি হয়েছে মানে আমাকে 10 মাস শুয়ে থাকতে হবে এরকম কোনো ব্যাপার নেই। তুমি যদি বাইরে কাজ না করো, কেউ কেউ যদি হোম মেকার হয়, বাড়িতে কাজ করে, ইউ ক্যান কন্টিনিউ উইথ অল নর্মাল অ্যাক্টিভিটিস এট হোম লাইক ফর এ ন্যাচারাল প্রেগনেন্সি। এরকম না যে আইভিএফ হচ্ছে মানে আমাকে সব ছেড়ে শুয়ে থাকতে হবে, কারণ the more distracted you are by other things, your hobby, your work, it is better for you. না হলে 24 ঘন্টা তুমি যদি বিছানায় শুয়ে শুয়ে খালি চিন্তা করো যে আমার আইভিএফ হচ্ছে, আমার এটা পজিটিভ হবে না নেগেটিভ হবে, তাহলে anyone will be prone to panic attacks, and that is not healthy. That is not healthy from both an emotional point of view as well as from a physical point of view. So that is not encouraged at all.
Outcome will not be
Absolutely
desired.
না, that is not encouraged at all. এগুলো অনেক ওল্ড স্কুল অফ থট। আগে যখন আইভিএফ শুরু হয়েছিল তখন ডক্টরস অলসো বি ইউজ টু বি মোর স্কেয়ার্ড অ্যাবাউট দ্য ট্রিটমেন্ট। তখন তারা হয়তো অনেক সময় পেশেন্টদের এই ধরনের অ্যাডভাইস দিত, বেড রেস্ট এন্ড থিংস লাইক দ্যাট। কিন্তু এখনকার দিনে when the treatment is getting more and more standardized by the day, we absolutely don't recommend bed rest to the patient until and unless there is some other complication. তাই জন্য when you are undergoing IVF, when you have conceived through IVF, please carry on with your normal life. See, what you have to understand, IVF is just a treatment, or pregnancy is just a condition, it is not a disease. ঠিক আছে, প্রেগনেন্সিটা অসুখ না that you have to be in bed all the time. ঠিক আছে?
Absolutely, ma'am. আমাদের পরের প্রশ্ন করছে কৌশিক দত্ত। কৌশিক is asking, so he's basically saying that a cousin of mine has become a mother through IVF at 35 years of age. However, her son has had multiple illnesses during his infant days, much more than normal. Is immunity a natural effect in children born out of IVF?
No, not at all. Your question is probably, what you mean to say is whether যাদের বাচ্চা আইভিএফ এ হচ্ছে আর যাদের বাচ্চা ন্যাচারালি হচ্ছে তাদের মধ্যে কোনো ডিফারেন্স আছে কিনা।
Difference হচ্ছে কিনা?
না,
Correct.
একদম নেই। ইনফ্যাক্ট মানে জাস্ট দ্য আদার ডে আমি একটা স্টাডি পড়ছিলাম ইন ইউরোপ, where they were comparing the IQ of children born through IVF. So they were saying that it has been seen that IQ of children born through IVF is no different from children who are conceived naturally. So, and it holds for every other thing. See, what you have to understand, IVF treatment একদম একটা কালকের ট্রিটমেন্ট এরকম না। This treatment has been ongoing since 1978, which is quite a long time now. ঠিক আছে, প্রথম IVF বাচ্চা হয়ে গেছে। ঠিক আছে, তো দ্যাট ইজ হোয়াট উই হ্যাভ টু রিমেম্বার, যে আইভিএফ ট্রিটমেন্টটা এরকম না যে একদম একটা নতুন ট্রিটমেন্ট, কালকেই এলো, আমরা এ ব্যাপারে কিছু জানি না। ইট ইজ নট লাইক কোভিড ভ্যাকসিন, কোভিড ট্রিটমেন্ট, ইট ইজ নট লাইক দ্যাট যে জাস্ট 2 বছর আগে শুরু হয়েছে, আমরা এ ব্যাপারে কিছু জানি না। বাই নাও তো উই নো সো মাচ অ্যাবাউট কোভিড ইভেন, সো লেট অ্যালোন আইভিএফ। তো 40 বছর ধরে যে ট্রিটমেন্ট চলছে, সেই ট্রিটমেন্টে যদি এর থেকে বড় কোনো প্রবলেম হতো তাহলে নোবডি উড হ্যাভ ভলান্টিয়ার্ড ফর আইভিএফ। ঠিক আছে?
Absolutely, ma'am. Would you also like to say a few words here, ma'am? Hindu, ma'am?
Just I want to add here, whether it is a natural pregnancy, whether it is a through art, but definitely prenatal and perinatal health of mother plays very important role.
Yeah, very true.
Yes.
ইনফ্যাক্ট এখনকার দিনে আমরা যে এত ইনফার্টিলিটি দেখি, তার একটা বড় কারণ হচ্ছে বিকজ অফ আওয়ার লাইফস্টাইল, হুইচ ইজ ভেরি ইম্পর্টেন্ট। দ্য প্রবলেম ইজ উই ডোন্ট লুক এট আওয়ার সেলভস। মানে আমি যখন আইভিএফ করতে আসছি বা আমি যখন ন্যাচারালি প্রেগনেন্সি নিচ্ছি, হোয়াট উই হ্যাভ টু আন্ডারস্ট্যান্ড দ্যাট এজ আ কাপল উই মাস্ট বি ভেরি হেলদি। আমাদের প্রপার বডি ওয়েট, প্রপার লাইফস্টাইল, দে শুড বি মেনটেন্ড, বিকজ আনটিল এন্ড আনলেস দ্য মাদার অ্যান্ড ফাদার আর হেলদি, উই ক্যান নট গ্যারেন্টি আ হেলদি অফস্প্রিং. So that is very important because the offspring is being born out of them. So it is very important that they are healthy to ensure a healthy offspring. It is not about the treatment, it is about ourselves.
Absolutely.
Right.
And diet and exercise also play a big role here.
Very important
Yes.
role. A couple must be mentally and physically fit before a couple decides to start a family. So that is very important.
Yes.
So it is not the treatment. এই কোনো couple যদি unhealthy হয়, either husband or wife or both, even if they conceive naturally also, in that case also there are expected to be complications. So it is not about যে IVF হচ্ছে বলে প্রবলেমটা হচ্ছে,
True.
Right.
other way around, because they have a problem they are having to take recourse to IVF.
Absolutely.
ঠিক
Absolutely.
আছে?
It's really been an insightful session, and it's such a sensitive and a very very important topic that Indu ma'am also uh, she kind of she has found some time out, and we are here
Thank
today.
you.
It's
Yeah.
really been a very insightful session, and we can see a lot of viewers also. They're very interested, asking a lot of questions. So I think we can have such sessions again, definitely. So there's just one question that I can see. I'll take this question since we have already discussed. But I guess we can take it. That is, infertility is still looked down upon. How does one cope with the fear of acceptance? আমরা এটা নিয়ে আলোচনা করেছি, but still, if you would like to, since Indri ma'am was facing some
Yes.
difficulty, technical problems, so we can discuss that bit
Rupsa.
also.
Yes. As I told you, don't take it as a personal. It's a medical condition. And when you externalize problem, when you think that infertility is inside me, then you feel sad, you feel depressed. When you externalize the problem, okay, yes, this is a medical condition and I am taking a treatment, so you will feel less stress. Then you will not feel inside me. Don't label yourself, first of all. This can give you a good acceptance.
Ruksha, you know what I keep telling patients, that see, you cannot change others, you can only change your own thinking process. Okay, see, very frankly, in the community or in the family, if everyone is looking down upon you for not being able to conceive, very frankly, even though we counsel, we cannot counsel everyone. Obviously, we cannot bring the whole community and counsel. So it is a mindset. So that is a mindset that needs to change, but what we can change is we can change our reaction to that mindset. Okay,
Right.
stop
Absolutely.
reacting to people who are looking down upon you. That is very important. Okay, don't react. It is very important that as a couple, you and your husband understand what is the problem, what is the treatment being offered to you, and proceed accordingly. And as we said, infertility is a medical condition, it is a disease, so there is nothing to look down upon, no matter whose problem that is. And most of the times the problem lies in both the partners.
Absolutely.
And Rufsa,
Now,
I would like to say you that you are a beautiful woman. See yourself as a whole woman. See there are so many positive things in you. Don't think that this is a kind of, don't feel inadequate in terms of your problem. You will come out of it.
very
Very
nicely
true.
said, ma'am.
Women, you have a life beyond conceiving and fertility.
Absolutely.
So you are not just defined by whether you can conceive or not.
Absolutely.
And it's not an
Very nicely
ability, or
said.
it's not a kind of capacity or talent. Count you somewhere else. It is only this biological thing, and something is not working, and you are taking treatment. You will come out of
Which is
it.
absolutely fine. Yes. Mhm. So we will take one last question. Uh, so Rahul Mukherjee is asking, can a man undergoing treatment also go through mood swings similar to their female partner?
Absolutely, yes. Because see, parenthood is a dream of both the partner. It's not a women centric problem can be in any whether it is in a female partner, whether it is in a male, or whether it is in a both, but the emotions are attached to male also, and they have a, due to different gender, they have a different, they experience this uh, pain in a different way, and they have a different kind of coping mechanism. Definitely this mood swing is very normal and natural and very common when the they are going through this phase.
And in fact, I would like to add, sometimes in IVF, we need third party help. in the form of donor sperm or donor egg. So most of the times what we see, আমরা যেটা দেখি যে সেটা একজন মহিলাকে বললে সে যেভাবে নেয় আর একজন হাজবেন্ডকে বললে সে যেভাবে নেয় দুটো কিন্তু আলাদা. Sometimes women also don't take it well, but most of the times they accept it more readily, I would say. কিন্তু একজন হাজবেন্ড কে বললে if they are counseled that there is no way you can conceive by your own sperms or anything, that you need donor sperms, তখন কিন্তু অনেক সময় হাজবেন্ডদের ক্ষেত্রে সেই অ্যাকসেপ্টেন্সটা আসতে আরেকটু প্রবলেম হয়. তাদের হয়তো সেইটা মানে ফর মেল ইগো অর হোয়াট এভার, এই জিনিসটা কিন্তু তাদের ক্ষেত্রে আরো অনেকটা প্রবলেমেটিক বেশি হয়. সো দে অলসো নিড কাউন্সেলিং. ঠিক আছে? অ্যান্ড ইট ইজ নাথিং টু বি অ্যাশেমড অফ. ঠিক আছে?
Right. Absolutely.
Absolutely.
As
Absolutely, ma'am.
Hindu is repeatedly emphasizing, this is just a medical disorder. Husbandry হোক, ওয়াইফেরই হোক. You know, when we were in MBBS, when we used to have a very small chapter on infertility. And the first thing that we were told that in infertility there are no patients. This is the only stream of medicine where there are no patients. These are very normal people. They are a
Right.
couple who are coming for your advice. So there are no patients in that sense. So don't call. Most of the times the husband would call up and say, "Amar patient ke anbo," meaning the wife. The wife is
Right.
always the patient. So there are no patients in infertility. ঠিক আছে? So that is very important to understand.
Very interesting point. This is very, yes. So I think we are almost towards the end of the session. And before we conclude, Indu ma'am, I would request you to say a few words before we sign
Yeah.
off today.
Whoever watching this, I want to say them, it seems like it is never ending, but trust me, it's not a permanent phase. Definitely you will come out, you will have your bundle of joys, but you have to also work this. If you are going for IVF, it's a collaborative approach. You are taking this medical treatment, but you have to take care of yourself in a very good way. I would like to say this biopsychosocial model of care. In bio, your physical care like proper sleep, good diet, your hygiene, exercise, everything comes in the bio. In the psycho, you have to take care of your emotions, try to find out your negative thought, because every thought, every emotion has some biochemical reaction on your body. So take care of your emotional and mental health, and of course your social health. We are a social animal and we need some connection. So try to vent out your feeling, don't suppress your feeling. And especially I would like to say, couples, enhance your intimacy, enhance your emotional bonding as well as physical bonding also. Don't think that you are going for art treatment, you are not physically connected and all. It will enhance your bonding, and definitely trust me, you will have your bundle of joy. And count your blessing as puja is coming. It's don't put your life on hold that what will I do, I don't have baby, I have to not celebrate puja. Just enjoy, accept the present moment, be in the present moment. And you cannot change your past. If you have this any cycle failure, it's okay, but definitely you can do something for your success in future. So enjoy puja, count your blessings, and you will be blessed definitely.
Very nicely framed. Very nicely said, ma'am. Thank you so much.
Thank
Some
you,
words
Indu.
from you also,
Welcome.
Indri ma'am. Some words
No,
from
I
you.
already said what I had to say. So I think we will enjoy puja and come back with our next session on something interesting. Yeah.
Absolutely. Absolutely. Thank you so much. And thanks to all
Happy
our
puja
viewers
to
to be part of
everyone.
this. Yes,
Happy
thank you,
puja all
viewers, to
of
be
you.
part of this live session. Happy Puja. Take care. Thank you so much.